Welcome. I'm Stacey Troha, Chief Executive Officer for Lions Eye Bank of Wisconsin. And today what I'd like to do is answer some of the many questions we've received regarding how the global pandemic has impacted the eye bank, how it's impacted cornea donation, and what steps we can take to make sure that we're able to continue to provide the gift of sight here in Wisconsin, nationally, and internationally as well. So, to fully understand what happened in 2020, we first have to remember that the eye bank provides tissue because we actually function as a well-established system of partnerships. And all it takes is for one of those partners to become debilitated or to be severely impacted, and it'll impact the whole system. It'll impact everything that we do. And 2020 started out as a fantastic year for the eye bank. The eye bank was actually on track to have a record-breaking year. However, by February, we were already starting to see some issues with our international tissue placements. And the main issue that we were having was finding flights. We were having a hard time trying to find flights because as countries were taking steps to keep the virus from coming into their country, there were also flights being canceled left and right. And as those flights got canceled, it meant that there were fewer and fewer options for us to transport tissue into other countries. And those available flights disappeared incredibly quickly. On March 14th, President Trump blocked all non-essential arrivals into the U.S., and then the very next day, the European Union did the same thing. So flights to transport tissue literally just disappeared. And we have to remember something really important about that. The eye bank first starts out by providing tissue locally here in Wisconsin, and then if all those surgeries are taken care of, we'll look nationally, and then we look internationally. But internationally, nearly half of our tissue is traveling to places all over the world. In 2019, our tissue traveled to over 30 different countries. And now what that meant was that nearly half of our tissue was no longer having a home. And it also meant, more importantly, that those patients in other countries were probably not going to receive the gift of sight, because so many times the only way to receive that gift was the availability of tissue from eye banks here in the U.S. In our own country, hospitals began preparing for a potential surge of COVID-19 patients, and hospitals had to halt elective surgeries for many reasons, such as they were reallocating staff and reallocating supplies and resources, conserving personal protective equipment. And in our country, a corneal transplant is considered to be an elective surgery. So with all of the elective surgeries being canceled and no place to put tissue locally or internationally or nationally even, we had to make the very difficult and painful decision to halt all donation. One of the important factors that we wanted to understand while we were having our downtime and then continue to track thereafter was the impact of COVID-19 on our eligible donors. And what we learned was really not that surprising. Clearly, whenever the virus surges, we lose a larger percentage of our donors. We follow the Eye Bank Association of America guidelines when we're screening for potential COVID-19. The Eye Bank Association has very strict and very conservative guidelines, and they're also a little more complex. So we have engaged the assistance of our medical director designees to be available 24 hours a day, 7 days a week to assist our call center in making sure that if there is any possibility that the patient can become a donor, that we are doing everything in our power to move forward with that case. What does the road to recovery look like for the Lions Eye Bank? If we look at our outcomes for 2020 here in red and compare them with 2019 in blue and 2018 in green, we can see that we're not quite back to where we would like to see ourselves. But that's not unusual. In fact, nationally, we've been on par with most of the other eye banks across the country. The Eye Bank Association of America does a great job of surveying us to see what are our projections moving forward. So we know that in 2020, nationally, tissue placement was down by 14%, and tissue placement was down internationally by 45%. We know that in the first quarter, the eye banks in the U.S. are projecting that tissue placement will be down about 16%, and through the first half of the year, 14.5%. And that's mainly because we still have many challenges. We still are struggling to find flights. We're doing additional testing, which takes more time. And we know that our recipients are also getting screened for COVID just prior to their surgeries, so they will be healthy and have the best opportunity for recovery. But all of those things take timing and effort and new coordination that we haven't done before. So one of the questions that I've been frequently getting is, how can the Alliance help the eye bank? And many of the Alliance are already helping the eye bank. There are transporters. And as many of you know, for a period of time we weren't able to use our transporters. And then we started to go back and slowly evaluate each of the locations with the help of our hospital partners to determine which of these locations were safe for our volunteers to enter and which were not safe and we should probably hold off on using for a while longer. We also worked with our Alliance transporters and friends of the Alliance to help us establish some new locations. And I truly appreciate this because there's nothing like that personal touch in a local area with a new business to introduce the program and help us get it established. So we do have several new locations. If you don't know where the new locations are, do not worry about it. When you're dispatched, we will let you know exactly where the new locations are, and we will give you any information you need to know about it. Most of the new locations are very close to where the old locations were. We also have several new recovery staff in the north and in the Milwaukee area, which means that we won't have our Madison staff doing recoveries and returning with tissue from those areas. So we should be seeing a nice upswing in the number of tissue transports in the very near future. There is one important message that I want to give to our transporters, and that we do need help in making sure that tissue is coming in as quickly as it possibly can. Inside every box of tissue is a blood sample, and we take that blood sample, put it on a flight, send it to Denver, Colorado, where that can be analyzed for contagious disease. Unfortunately, there's still only one flight to Denver. If we miss a flight, it means that the case is delayed by 24 hours, and that can sometimes mean that 24-hour difference can sometimes mean that we lose the opportunity for transplant. So very important to try to get the tissue boxes into the eye bank before noon, as much as you can. Whatever you can do to help, don't speed, be safe, but keep things moving, and that can make a difference between us having a transplant placement and not. In closing, I want to share with you something that has given me such incredible hope through all of 2020. And what that is the amazing acts of kindness and selflessness that I observe every single day. And it really starts with our donor families. 735 donors and their families, individuals who perhaps couldn't have a funeral service this year, perhaps some of them even became sick themselves, or they had lost multiple loved ones, still considered that others may need help and still offered to give the profound gift of themselves and offer a chance for a better life to someone else. And I think of our recovery staff who daily go out into the field, to the front lines, without fear, incredibly brave, to play their part and do their role so that the gift of sight can be possible. And all of the nurses and staff in the hospital who support us and continue to make calls for referrals even when their ICUs are overflowing, even when they themselves haven't had a break, and continue to think, this is important. I'm going to make the commitment to doing my part and do my role and make that call so that someone else can be helped. And I think of all of the transports that, all of the tissue that's carried in lovingly by our Alliance transporters. And I think of all of the surgeons who have worked with us around the delays, around the challenges, and the medical staff who've been willing to help us pick through all of our criteria and get to the bottom line. And sometimes the bottom line is no, the person can't donate after we've had consult after consult. But all of these things add up to one thing, and that is this core behavior of being committed to something greater than yourself, being committed to making sure that tomorrow is a better day for someone else. And those acts of selflessness, those acts of kindness are something that I carry in my heart every single day, and something that gives us hope at the iBank every single day. I thank you for your commitment, to your dedication, because I know that sometimes it's meant that you're fulfilling an obligation despite the odds. It has meant this year that sometimes you have to sit in that parking lot a lot longer because somebody had a delay or they can't find the new location for the drop-off. And all those things that you do, although they are inconvenient or they are more difficult, it still means that we're able to provide the gift of sight. And it's because of the commitment of every partner, every step of the way, that makes it possible. So thank you for your support. And thank you for your continued support.